Welcome to your role as an IPC focal person at Kampong Chhnang Provincial Hospital. Your primary objective in this position is mastering the biweekly hand hygiene observation and accurately logging that data into our digital system. The hospital operates under a strict, mandatory compliance target. We must hit 75% correct hand hygiene across all departments. Falling below that threshold directly increases the rate of healthcare-associated infections, putting vulnerable patients at risk. Before you step onto the ward to conduct your assessment, you must secure 3 exact prerequisites: a fully charged mobile device or tablet, an active internet connection, and the paper backup form, Form KCPH-IPC-HHF01. Printing that specific paper backup is a strict operational requirement. If your tablet battery dies mid-observation or the local network drops, you switch immediately to paper and finish the session. By securing these contingencies before leaving the office, you guarantee that unpredictable technical failures on the floor will never compromise the collection of the hospital's safety data. Your observation schedule is fixed. You are required to conduct these assessments twice every week, specifically on Sundays and Wednesdays. When you arrive at the department, start with a physical environment check. Walk the floor and verify that alcohol-based hand rub and functioning soap and water stations are available at every single patient care point. You must enter the clinical area covertly. The Hawthorne effect dictates that people change their behavior when they realize they're being watched, skewing our data. You need a sample size of at least 5 healthcare workers per visit. Select staff across different roles. Observe a physician, a nurse, and a member of the support staff to get a cross-section of the department. These operational rules align directly with the national guidelines set by the Cambodian Ministry of Health. Rigorous, standardized infection control tracking is a mandate at the national level. Observing a diverse sample of staff without alerting them removes performance bias. You capture an unmanipulated reflection of the department's actual daily infection control habits. As you watch those 5 staff members, you will evaluate them against specific compliance criteria, beginning with their physical attire. Evaluate their compliance with the bare below the elbows policy. During direct patient care, staff are strictly prohibited from wearing rings, watches, or bracelets, and all long sleeves must be rolled up above the elbow. Next, check the fingernail constraints. Nails must be kept short and entirely unpolished. Artificial nails and gel overlays are strictly banned in all clinical areas. Watch their movement around the patient zone to see if they perform hygiene at the correct trigger points. We track the 5 moments framework established by the World Health Organization, which defines the exact instances hand hygiene is required. Time their cleaning process. If their hands are not visibly soiled and they use alcohol-based hand rub, the application must last 20 to 30 seconds. If their hands are visibly soiled or they suspect spore-forming organisms, they must switch to soap and water. You will count a full 40 to 60 seconds for this method. Removing jewelry, trimming nails, and hitting the precise WHO timing thresholds removes the physical environments where microbes hide. This specific combination of actions breaks the mechanical chain of infection. Once your walkthrough is complete, open the KCPH monitoring tool on your device to begin the data entry phase. Start by inputting the metadata. Select your specific area from the 26 clinical and supportive departments, then enter your name, the current date, the staff role you observed, and the shift. The tool organizes your observation into 3 core evaluation categories: hand sanitation, the 5 moments, and the 6 steps technique. Together, these contain 20 distinct checklist items. For each item, apply binary scoring. Mark yes if compliant, no if missed or incorrect, and NA if it didn't apply. Pay attention to this critical failure warning. The application features built-in validation logic designed to prevent empty or useless submissions. You must answer at least 10 out of the 20 total checklist items. If you submit a form with fewer than 10 answers, the record is flagged as invalid and rejected by the system. Clinical environments are chaotic, and you won't observe every single interaction. Mandating a 50% completion threshold gives you flexibility on the floor, while still maintaining enough statistical reliability for the final report. To complete your entry, tap the Save Assessment button at the bottom of the screen to lock in the scores. If you lose Wi-Fi on the ward, the tool's fail-safe activates. It saves your entry locally to the device and will automatically sync to the cloud the moment your internet connection is restored. Every Friday, the chief of the technical office logs into the system and pulls all the synced data to compile the master cross-department report. This compiled data has direct consequences. If the weekly aggregation shows your department scoring below the 75% overall compliance threshold, the head of department will be slapped with a formal corrective action plan within 2 weeks. This process generates the hospital's vital early warning system. By conducting rigorous observations and logging accurate data, you hold the staff accountable and protect patients from life-threatening outbreaks before they happen.